In our short series on telephone triage, we've defined telephone triage, we've talked about use of the nursing process, and we've talked about appropriate use of decision support tools. Now let's turn our attention to documentation of the telephone encounter. Let's start with, if it's not documented, it wasn't done. I had an attorney one time in deposition ask me, do you believe that nonsense that if it's not documented, it didn't happen? And I said, what I do believe is if you don't document it, you cannot prove it happened. Therefore, it is critical that we document every call. For some of you, you will be surprised to hear me say that we even need to document the calls when we give the patient an appointment. Keep in mind, please, that this is a nurse-patient encounter. And as a professional nurse, we are responsible for documenting that encounter and indicating that we have followed the standards of care. The other thing that's really important to remember is that we want to paint a picture. The person who reads the document, we want them to be able to see the patient in their mind's eye. As we discussed in the section on assessment, the value of documentation, we often think, is that it's a legal document, and it is indeed a legal document, but it is first and foremost a communication tool between us and other members of the healthcare team who will be providing other elements of care to the patient. Furthermore, the document also helps us organize our thinking so that as we've jotted notes of what the patient has told us, we're able to look back over those notes to try to make some sense out of the information that we've been provided. From a practical perspective, I think that there are a couple of things that can't be overlooked. The first is learn to type. I understand we're nurses, we're not secretaries, but in the 21st century, typing is very much a skill that is required of all healthcare professionals. The second observation I would make is that it's important to do real-time documentation. That means while we're talking to the patient, to be typing our note. One of the beautiful things about the computer is that we can always go back and delete or correct elements of our documentation. If we've misspelled, if we've used incomplete grammar, that can always be cleaned up. But capturing what the patient is saying as they are saying it is very valuable in that, first of all, if we are typing it into the medical record instead of jotting it on a piece of paper, then we're preventing rework. The second thing that we all know is that real-time documentation represents the standard of care for nurses. So never, ever, ever go on to your next call before you've completed documentation of this call. And then the other value of real-time documentation is that a patient might say something to you that doesn't seem particularly relevant at the moment, but in the context of the entire call is very relevant, and you might not realize that until later in the encounter when you look back over your notes. Whatever kind of documentation you do, you need to be sure that you've included the nursing process because as we discussed in a previous presentation, the nursing process does represent the basic standard of nursing practice. So whether you're doing a SOAPy note, whether you are simply documenting an adequate subjective and objective assessment prior to entering the decision support tool, it is important that you give some thought to documenting the nursing process. One area deserving of attention in telephone triage involves documentation of pertinent negatives. Pertinent negatives are elements of the patient history that are negative or absent, but their absence is just as significant as their presence would be. For example, in a patient with chest pain, shortness of breath, nausea, and diaphoresis are always significant regardless of whether they're present or absent. If the patient does complain of shortness of breath, nausea, or diaphoresis, those would be pertinent positive findings, but if they're absent, they would be considered pertinent negatives. It's critical to document both pertinent positives and pertinent negatives. This documentation can be accomplished in one of three ways or using a combination of different approaches. First, assuming adequate policy support, the least labor-intensive approach, also resulting in the most brief documentation, would be to simply select the first positive response in a prescribed list of protocol questions. The second approach would be to mark yes or no to each protocol question, thereby indicating which findings are positive and which are negative. This is slightly more descriptive, but also results in a little more documentation. The third approach would be for the nurse to document the pertinent findings, both positives and negatives, in the narrative section of the assessment. While the first two approaches can technically be regarded as adequate, assuming they're in compliance with organizational policy, what they lack is that they don't indicate the nurse's independent line of reasoning, which can be of significant value to the reader. While I understand that we all want to keep our documentation to a minimum so that it's easier for other members of the healthcare team to read, the fact of the matter is that if a picture is worth 1,000 words, then it stands to reason that it takes 1,000 words to paint a picture. And thus it follows that we should let the desired quality of our medical record dictate the amount that we document, not vice versa.
Carol Rutenberg is a nationally recognized expert and speaker in the field of telephone triage. To learn more from Carol about the ideas in this video, you can refer to The Art and Science of Telephone Triage, written by Carol and her colleague Liz Greenberg and endorsed by the American Academy of Ambulatory Care Nursing. This video training series was produced and sponsored by ClearTriage, an online version of the Schmidt-Thompson telephone triage protocols that is compatible with Carol's teachings and widely used as a decision support tool for telephone triage nurses in practices and clinics.